Like clean, fresh water flowing down the mountain from a spring, the powerful example of Pastor Victorio Paz and his small, remote church in Abelines has begun to spread to dozens of churches in the mountainous northeastern region of El Salvador. Located in the foothills of the Abelines region, near the town of Moncagua, the Dios de Profecia Church had the chance to see firsthand the change that can happen when a church begins to serve its community effectively. And from the very first time ENLACE's staff met the pastor and members of the church, it was obvious that they were a church ready to transform their community.
What motivates us is the love for our neighbor, the needs of the community, and seeing the unity that there is between organizations like the Community Association and the Water and Health Boards. It motivates me, and I believe it motivates the church to continue serving alongside them.
The area suffers from extreme poverty and a high infant mortality rate. Most residents have to travel long distances and pay high prices to see a doctor in overcrowded and understocked public clinics. In addition, their water system is falling apart and doesn't provide enough water for the growing population.
The system was created more than 20 years ago, and so all the piping, pumping systems, and water tank needed to be replaced. But now in all the surrounding communities we have the new piping. A new well was drilled and we've installed a bigger pumping system. The only thing left for our water project is a new, bigger tank, and that's the most important part.
God has clearly placed a call on the hearts of the church's 110 members to serve their community. The church began by partnering with their mayor's office to provide occasional visits from a doctor and basic medicines in a makeshift clinic. In 2010, ENLACE's medical doctor, Dr. Zulema Cahin, began regular visits to the area and saw more than 160 patients each month. She also trained the newly formed health committee and conducted home visits for people unable to travel to a clinic.
The doctor has done miracles. She has had patients who have never been to a hospital because they are afraid or because they don't have any money. She has patients that she sees month after month and provides ongoing care that they would never have otherwise. For us, the doctor is a fundamental part of the team.
When all this started, we never imagined how many people the clinic would reach. People come from all over. They even come from the city because God has blessed us with a kind doctor who serves anyone who needs attention. They come because they are given excellent care.
The church and community have a clear vision for a healthier community in the coming years, and they've identified multiple opportunities, including improving their water system and building a health clinic.
Now, because of the current demand of patients, these facilities are simply no longer big enough. A proper medical consultation requires a certain amount of privacy for the patient, and we don't have that space. Even though I will continue to serve patients, we do need an improved clinic.
If there is anyone who can help us with a better water system, then I welcome them with open arms. The tank has cracks on both sides, and sooner or later, we're going to be without a tank. We are poor people who need help and training. Many of us can barely feed our own families with the corn and beans that we can find. But I know that that water system really isn't for me. It's for my children and grandchildren.
With the support of churches like Orange County First Assembly, the Dios de Profecia Church will undoubtedly transform the lives of thousands of people in their community, while replicating this impact throughout the region.